Hey everybody, we know that you are in the throes of social distancing and are wondering when it is all going to end. So we wanted to check in with our Allen Fire Chief, Jonathan Boyd, to find out kind of where we are in this whole curve of cases and find out what we can do to help. Thanks for being with us.
Thank you.
All right, so we have had a series of executive orders take place or take effect over the last few weeks. They all have, in various ways, encouraged social distancing. Are these working? What impact are they having in Allen?
Well, I know that it's everybody's getting a little antsy. It's tough to stay at home this long, but the short answer is they are working, and we know they will work because we can look at other states who have implemented social distancing policies and see kind of the trends that they're seeing. Because, like for example, one of the states that we looked at is Washington. You know, they had cases before Texas did. They reached 100 cases in Washington about 2 weeks before Texas did. And so we can look at them and kind of just assume that they're 2 weeks ahead of us. So when you look at that, you can see that before they put in their social distancing policies, it was a 17% increase in cases each day. And that dropped down to around 11, 12%. But about 2 weeks after they put their social distancing policies in place, now they're seeing a daily case increase of around 4 to 5%. And so, what we're hoping here in Texas is that we'll have the same kind of results. Right now, we see roughly 10 to 12 to 13% increase in cases each day. And we're hoping that, as the days go on, we'll see the same kind of results that we're seeing in Washington to where we can get around a 4% or 5% increase in cases each day.
That's great. And I know that we have all seen or maybe even shared those charts talking about flattening the curve. And that is all about making sure that we have enough medical resources to deal with the need when we reach that peak. When are we expected to reach the peak in Texas, and how are we doing on resources right now?
Well, there's several different models out there. The one that we use a lot is the IHME model. And that one, all of these models are based on assumptions, right? They're all a forecast. And just like any forecast, it'll change, right? So we've seen the anticipated peak be as early as April the 15th. We've seen it as late as May the 5th. Currently, it shows it roughly around April the 22nd. But if you go back and look at those same models and you look at the state of Washington, you can see that they're on the downward side of their curve, right? So when they have roughly 4%, 5% increase in cases each day, that's actually, that's a low enough increase where the hospitals are actually increasing their capacity, right? So they're getting more and more beds as they're on the downward side of that curve. Well, we're on the upward side of it. And so we want to do everything we can to try to limit how many people are going to need to go in the hospital, and we do that by this social distancing. And so that those models show that if we can keep it up, then we won't exceed the capacity of our healthcare system, and that we should be on the downward side of the curve in a few weeks.
I know that the flip side of these measures, which are in no doubt saving lives, is that they are affecting a lot of people's livelihoods. And people, for the first time, they may be in a situation where they can't make their rent or they can't make their mortgage. What sort of resources are available out there to help?
Well, I mean, yes, and that's the tough part about all of this is that it is a sacrifice for all of us to do this, and um, there's unfortunately there are people that are really suffering because of this. And what I would suggest is that I would go to thecityofallen.org/coronavirus. There's a section called community support that lists several community support areas from food banks to rent assist. There's lots of different resources there for people to go look at and find resources available. And people can also call our helpline. Our helpline keeps a list of programs or outreach programs that are trying to connect with people who have needs. So give them a call and we'll try to connect you with a program that may be able to help you.
We are all eager to move on with normal life. What are some ways, as we are still in the thick of this, that we can help get this thing over with?
Well, yeah, it's hard because there's it is tough. The social distancing requirements are tough, and it's easy to get impatient. But the thing that I can tell you is that it is working, and it is still important. So continue to stay at home whenever you can. If you need to get out, make sure that you're washing your hands and you're disinfecting. And then, of course, if you're sick, don't go out at all. And then most recently, the CDC has recommended the wearing of masks if you can, so when you're among other people, because what you're trying to do is to prevent the spread of the virus. And it's not so much to protect you, it's just in case you have the virus and you don't know it, it prevents you from spreading it to other people.
Already, we've seen so many ways that our community is supporting each other and following these recommendations. And if you have just one final message for people watching, what would you say?
Well, every day, I am very impressed with what our community has done to support each other. The best thing that you can do for your neighbor right now is to stay home because, the virus needs other people to be able to spread. And so if you can stay home, that's really the best thing you can do for your community. But there's been so much outreach, so much help offered to everyone in this community. I'm very proud to be a part of it. I knew we could do this together. We're going to do it together. I'm just, feel really happy to be a part of this community and to be able to serve this community.
All right. Well, thank you for taking some time out of your busy day. I know that it has been a busy few weeks for you all. So thank you for giving us some insight, and we look forward to talking to you soon.